this. And if you see here, you have two superior and inferior multi-axial locking screw, which is different. So in other companies, you have a fixed angle locking screw, whereas in this particular system, you get multi-axial locking screw, so you can change the direction. So you have a sleeve. So you have a sleeve which you fix it up, and then you have a multi-axial dimension, so you can change the direction of the screw that you want. So the superior and inferior screw, which are important and which should be locking, can be drilled in any position, and they can be locked into that particular position. So that is so depending on the we'll just see in that. So depending on the position, you can just supposedly if your plate is not exactly superior inferior but maybe mainly posterior inferior, you might consider directing your screw on the base of the coracoid. So it depends on what is the position of your plate. So we'll just see it right now. So what you can see here is this is basically the glenoid, and basically you have two options to drill the central hole. So this is the number 0 and this is number 10. So you can have 10 degree superior angulation. So what you can do, so if you want to have a superiorly angulated glenoid, you put it right here. The inferior margin of the drill guide should be in line with the inferior margin of the glenoid, and you place it right here onto its place, and then you can just consider it. So when you hold it like this, or I will hold, you can feel it. So you put the inferior margin of the sleeve parallel to the inferior margin of the glenoid. Keep it right here, and you can ask your assistant, or you can drill it right there. Okay, so this is the central hole, and this is the most important step of the procedure, because that will guide your version and that will guide your position of the. Stop. So that is what I am telling you. So if you want to check it, and if you can place your finger right here on the neck of the glenoid. You can just palpate it right there, and it should hit the tip of your finger. And if it is hitting the tip of your finger at about this much of distance, then you are perfect and you are sure that you are in a proper inclination inversion. It should not exit on this side. If you are exiting on the posterior aspect, then it is probably too much of antevertically. Okay? So anteroposterior should be centered, and the uppermost part, the base should be on the borderline of the inferior part of the inferior border of the Glenosphere. So this is a very perfect position that we can see. Okay? Now this is basically, you can check it, you can see your posterior, you have posterior retractor. So you will have a posterior retractor on this head. I usually don't use an IITV. I'll just take a last shoot in the end. Usually IITV is not needed. If your exposure is good, what you will be doing is you will be putting one retractor here. The retractor will be somewhere. Hello. Hello. So the most important thing at this point of time is exposure. So you need to expose it really nice on the anterior aspect, on the posterior aspect, and on the inferior aspect. When you are resecting the capsule on the inferior aspect, you need to be very careful regarding the axillary nerve, and you need to be very close to the bone, and occasionally you may need to release the long head of the triceps, which is attaching right here. So this is important step, this is important step, and this is important step. And once you have released everything, you can just put your retractor right here. So this retractor will be always be coming in your way when you are doing the retraction. Just hold it. So this retractor will be coming like this, and at this point of time, these 3/4 retractors are, these 3/4 reamers are very helpful, because usually if you use any other.
So we are playing the same thing on the main screen also.
So this 3/4 reamer will be very useful at this stage. So what you can do is you can enter in this direction. can go like this and start your reaming. Okay. If your inclination is good and if you are reaming perfectly, you will see what is called as a smiley sign. The smiley sign basically means that you will ream more inferior. So that means that you are reaming more inferior as compared to superior, and this will lead to a very good glenoid preparation right here. Okay. So this is how much I would like to ream. So you should have this much of tissue which is outside. Now, once you have done this, there is a central lever which is a 11 mm lever, which you will ream to the central foot. So remain like this. Okay. So once we have done this, we are ready to put our glenoid base plate. Now, important thing is the central fixation. So as I told you, there are 4 methods. You can use a 6.5 screw. In revisions, you can use a 9.5 screw, and then you have small post and large post. So lot of options even for revisions you can use it. And then you can just remove your guide wire. So as I told you, for guide wire placement, you can have the free of planning, the blueprint software will help, and occasionally you can have the guide as well. Now this is the central guide drill guide for the 6.5 mm screw. You have a similar thing for a 9.5 millimeter screw. So what you do is you just put it right here, okay, and tap it into the position. So you tap it into the position, and then you can just ream with the. Okay, so it is almost there. And this also you can feel with your finger when you are doing it. Okay, so then you are pretty sure. And this, if you can see, is marked. This drill bit is marked. So whenever you are reaming, you can have an idea about the perforation of the distal cortex. And if you are in doubt, you have to take the bigger one. So if you are between 25 and 30, you have to take 30.
We should ream bicortical.
Bicortical. Central screw is very important. Application of central screw. Because whole of the construction will be based on the central screw per se. Now this is how they will. This is the depth gauge that you will that comes with the system. And this again goes like this. You touch it here. Then you line. So this is approximately 30. Okay. So 30 central screw along with lateral screw. Okay. So you will fix it. This will fix up in the anti-clockwise manner. So you put your screw here, and this construct will be done on the back table by the company person, and you will get this base plate in your hand. This is an intertidal screw. Okay. So now this is the screw, and this, as you see, is a 6 mm lateral offset base plate. Normally, in your standard scenarios, you can use a standard base plate, or occasionally the most common base plate I use is the +3 base plate. Depends. Then you can just guide it, and this area is the superior area. So you have to place it on the superior aspect right here. Okay. And this should be angled superiorly. This is very important. And then I will start putting my screw into space. So as soon as I am putting my screw, the base plate will start getting flush into the place. And then at one point of time, you will feel that it is very tension and it is not on its normal position. So once I am sure, I will disengage the base plate, and then I will remove this whole system.
Can the screw be fed, sir?
The screw can be fed if you want, and you can again, as you probably a little shorter screw in this system, but this is 30 items. This number is 25. So that is like this.
Which base plate to use standard 3 mm, 6 mm?
Normally I use a +3 lateralized normally, but you can use a regular. If you are using a 6 mm, it becomes too much tight.
Is it dependent on pre-op blueprint?
Yeah, blueprint will give you everything. Blueprint will give you everything. But supposedly if you are not using a blueprint software, then usually with this system it is recommended to have a little bit of lateralization. So a standard base plate with a Glenosphere which is lateralized, or a base plate which is 3 mm lateralized, it is up to you. So any lateralization on any of these two, either on the base plate side or the Glenosphere side, will be good for you.
So one not impact the
yes, so in other systems you have to impact the base plate. Like if you are using a Zimmer band system, you have to impact it. This system is basically based on the screw, and in the last final stage of the screw, the base plate will impact automatically with the tightness of the screw into the porous bone.
screw here can irritate in your
No. This is a very safe area. This is a safe area. The nerve is here. So that is why you don't have to go superior. So once you have done with this, you are very sure. And then you have this multi-axial locking bolt which will guide you. So here we can see that we have a good bolt, so we can go straight forward. Okay. That's it.
screws should also be bypassed.
Ideally, the superior and inferior screws are more important. So
After central first screw
you
we
can
put
put superior, yeah, you can put superior, you can put inferior, but this is perfect almost. Approximately 38. Some of you can do it. So important thing is to put a good superior screw and a good inferior screw. So if most of the cases, if you are not doing too much of lateralization, 2 screws superior and inferior with bicortical purchase should be sufficient. Occasionally you might put the anterior and posterior screws. Anterior and posterior screw, if any, they are not long screws, so you will get almost 14 to 18 on those most of the time. And then you can use the inferior screw. I am just omitting that step because of the time constraint. But one inferior screw is important, and then anterior and posterior screw depending on your which you can put it. And this is a collar lever.
As you said, anterior posterior screw are compression screw.
Yes,
So,
I need to put first. Yeah, but as I told you, we are putting it them as an extra screw. So it doesn't matter. You can put it afterwards. Also, anyway, you are putting a small screw, either 14 or 18. They will not be big screws, so because you will not get a good side here. So this is a collar lever. So in inferior part, typically some collar will be given. So you just remove that inferior part for us to get your Glenosphere to be sitting on to the base plate. Now comes the most difficult step. The most difficult step is the fitting of Glenosphere onto the base plate. Now this will take time and this will be somewhat tiresome because of the fact that your retractor will be lying here. And we will not get the right trajectory because the retractor will be lying here and we will not get the right trajectory to put it onto its place or retract it somewhere, and you try to do it but occasionally you will not get a good this is normal literalist. Normal. So this is occasionally can be an issue. So attaching this can occasionally be an issue. So the trick to that is you can just remove this because occasionally your retractor may be coming in the way for a direct parallel access. So you need to remove the retractor and then you can put your
So do we get modularity in this Glenosphere?
yes. So Glenosphere, there are 3 Glenospheres which are available. The standard Glenosphere, the eccentric Glenosphere and the lateralized Glenosphere. So here what you can do is now you can just use your screw to tighten it and somebody can just feel it. So you can feel the tightness of the screw as it is locked into the, once the screw is locked then you can impact it with an impactor. Most of the times I will use a standard or a 3 mm lateralized. Usually eccentric is not recommended nowadays, but if you want you can use it. If you want to distalize more, you can use an eccentric with an inferior offset if you want. Okay, and then in the final stages you will do a gentle locking. So this is a gentle locking step that you do in the hand. So once you have done the screw, you just put 2 hammers. Once you are done with that, you can just lock it into its position and that is actually fixed. So this is how we do our Glenosphere and basically the main preparation of the base plate and the Glenosphere. And this should be ideally be done with the humerus posteriorly dislocated with this retractor. So these two retractors are important, the anterior and posterior retractor, and this will give us a good exposure and good approach to place this into its place.
So the difference between augment when you have to use eccentric reaming.
So augment, if you are to use, there are two kinds of augments which are available. So this is full augment and then you have a half augment which is available. So then you have to, that it depends on what you have to prepare. So then there are a different system which will you have to prepare for. Initially you can just use the standard one and then if needed, you can go ahead and do the other preparation.
If you feel that there is some amount of posterior
Where then you can use, I would personally, my trend is to use half augments. I am not a believer of full augment. So if you need to use augment, ideally you should use a half.
So can we do first standard reaming and then convert if we feel that the erosion
Usually, ideally, it is recommended that you plan it on your blueprint before you do it because it's very difficult to arrange it and plan it in crop. But if you want to plan it in crop, it is better to use a half wedge as compared to full wedge. The reason to that is the full wedge does not have a rotational stability. You get my point? So if this is a full wedge, you reamed it, you prepared it, but when you impact it, this may rotate. Okay, so the full wedge does not have a rotational stability, whereas if you are using the half wedge, it is a rotationally stable construct. So it will be rotationally sitting on the preparation area only. It cannot turn around like this. So the half wedges are rotationally stable, and hence if you want to use the augment, it is strongly recommended that you use a half wedge instead of a full wedge. Okay.
So criteria for lateralization and superior inclination.
So normally you want to lateralize a little bit. So about 3 millimeters is what you want to go right. For Stryker system, try to keep it 3 millimeter lateralization. Either you can do it on your Glenosphere or you can do it on your base plate. That is your wish. Over lateralization in Indian patients can make your shoulder very tight. So avoid it. So little bit of lateralization is
superior inclination.
You have to have an inferior inclination. If the superior inclination, you put the Glenosphere in superior inclination, the chances of loosening and failure are high. So it should be either neutral to plus 10. 0 to 10 is the zone where ideally you want to put it.
Sir, direction for interiors, typically to get the best one, what would
You have to ideally do it parallel to the central pin or maybe directly in the little bit inferior. Because this is a multi-axial screw, so you can just depending on your position, you can see where the bone is more and you can really in that direction.
What is cutoff level of reaming?
First reaming, ideally you should get the smiley sign, as I told you. The smiley sign is basically you should have bone exposed at least on the inferior axis. That is called a smiley
Surface,
sign.
sometimes it's so sclerotic.
So ideally bleeding surface at least on the inferior 50% is ideally which is recommended, and then you can error on some. Now as far as the humerus is concerned, there are school of thought. Some people are taking freehand cuts, some people are taking cuts with a jig. So they have an extramedullary jig which is available, and there is an intramedullary jig which is available. Now this is, I'll just show you the intramedullary jig first because that is probably more accurate. So the intramedullary jig, you just make an entry pilot hole parallel to the so this is the bicipital tuberosity. So you need to be careful of the bicipital tuberosity, and you have to be close to the forearm. So you put your arm like this, and then usually I keep my version around 20, between 20 to 30, or you can keep it under your native version. So if you are doing it for a regular osteoarthritis case or a reverse shoulder case, you can put it on a native version. You fit it like this. So you put it and then you have a wire here, and this wire has to be ideally be made to the parallel to the forearms to get the exact version. So, and if you cannot get it, you can mark your anatomical version also. So anatomical version can vary from patient to patient, and if you are in doubt, you can just follow the native version of the patient. So once you are good with the version here, probably this is the correct version for this particular patient. And then you can pin to.
So this one has to be bent.
No, there is a pin which comes with it. It's coming in version rod. So there is a version rod which comes in the system and you can attach it here. So supposedly I want a 50 version and it's right here. The forearm will be here, somewhere around here. The forearm will be somewhere around here, and then I'll ask. There will be 2 pins, so you can pin 2 of the pins here. Somebody can help from here.
So do you routinely use 135 or do you?
No, for this particular system, this step is very important. You have to be 135 degree angle only. The conversion to 135 to 145 can be made with a poly. So you have an eccentric poly, asymmetrical poly, which can convert this 135 into 145.
कुछ नहीं देख रहा इसका
You have a comma. Comma है. Comma है. Occasionally, if you feel that it is not adequate, you can decrease or increase minus plus or minus 2. So if you want to increase or decrease it on this, you can just shift it onto this one, this and this. That will decrease the version level. One of you can do that. So this cut is very important. It has to be in proper inclination, proper version. As I told you, 135 degrees of inclination and 20 to 30 degrees of version is ideally which is recommended. You can change it a little bit as per your goals. So this is how you make the first cut, and you can see that this cut is almost perfect, very wanted. Okay, and now this is a metaphyseal cut stem. So the most important thing is the metaphyseal preparation right now. But before you do your metaphyseal cut, there is a protector which is there, which we use for the glenoid preparation. And the other important thing is you need to be sure of your cut before you start reaming. So this one is
This
stem ये कौन सा है? ये कौन सा है? ये one ही तो वही है.
So this entry point, how do you decide?
So this is almost on the posterior aspect of the approximately 1 centimeter posterior to the bicipital groove on the center. So once you are done with this, then you have sizes there. Now before you put this, you should be very confident about your cut, because once you are doing your metaphyseal reaming, you are committing yourself. So if you are doubtful on your cuts, you can revise your cut, take it again. Both your inclination and your version should be very clear before you, and you should be very confident about it before you do this step. So this step, so this is basically the next step. You have to hold it almost on the center like this, okay? And then you drill the central guide wire for the metaphyseal reaming, and you should engage the lateral cortex. That's it. So you just engage the lateral cortex, and then you can remove it. Okay, and then comes the metaphyseal reaming. So as Dr. Manit was describing, that this portion can be difficult for some Indian girls, ladies. So typically, I would recommend it to do very gently, and if possible, you do it back. Don't use mechanized or a very fast reamer to do this procedure, because if you ream it fast, this may lead to fracture of the metaphyseal. So do go very slowly in this step, okay, and just prepare very slowly. Or if you are doing on motor, then you do it very gradually, very slow step. This is there, okay, and you have to touch this to the base of the
photo block.
Cut.
Okay, so this is basically a 3-level reamer. So that this 3-level metaphyseal fit which is achieved, it is there. So that is okay. You can just make a little bit of wash to clean your this, and then this is probably your stem. And okay, so this will fit right there onto its place. And then what you need to do is you need to make the central wire. So it is debatable. Some people will not even make it. That doesn't make much of the difference. So you keep it right there and just put it. It will go simply. It will go very simple. Push it. That's it. So it will go very simple. Even if you don't make it, some people will say it will not make much of the difference. Once you are done with that, you attach the prosthesis with a version rod into its place, and then you have 2 hammer points. So you have to give a end to end, and then on the proximal distal and then lateral. So both of this is important, and somebody can just tap it in from here also. Because you have to go down and you have to do metaphyseal fit also. So this is on the metaphyseal fit, and this is for that.
Is there anything like valgus, varus?
So that you have to take care while putting the cut. So if your cut is in more of the angle, then the stem will go into varus. Okay. And supposedly, if you are not very sure about your cut and you feel that your cut is in more of inclination and you are not very sure, then the bailout is try a longer stem. So because the longer stem will go automatically and correct the version. So if this is normally it is recommended to use if you are using 2, you have a 2 and 2 short stem, 2 plus stem, and then you have a 2 long stem which is available. So supposedly if you are not very sure about your version and cuts, you can use a longer stem, and that will serve as a bailout if there is any issues with the cut.
And sir, if you feel that it's a very osteoporotic heredity, then you can only
Cement. Yes, you can cement it, but the need of cement should be less. So this is 2, this is 2 plus, and this is 2 long. Okay, so these are the 3 options which are available. Yeah, extra long. This is extra long, this is 2 long, and this is 2 plus.
The decision of taking 1 or 2 is depending upon that
Diameter. So diameter. So
not on the
female patients
shaft,
1 and 2
not on shaft.
on the size of the metaphyseal.
Yes.
It's a metaphyseal fit stem. It is similar to your THR,
So
like
it's
metaphyseal fit.
Surface replacement arthroplasty. It's like
Metaphyseal fit.
Metaphyseal
Metaphyseal
That
fit.
is the thing.
And then you have 2 kinds of poly. So this is a symmetric poly and this is asymmetric poly. So most of the times you can use this. And if you are worried about instability, then you can use this, converting 135 construct into 145 construct. So you can just attach it right here. And then you can just take the trial reduction and reduce it.
So how to decide
Version, usually anatomical version. So native version is one. So if you are doing like for a rotator cuff arthroplasty or you are doing for osteoarthritis, then you can see the version right there. Exact version of the native patient. Otherwise, it is recommended to keep it between 20 and 30.
In trauma patient.
Trauma patient, you have to keep it between 20 to 30 as per the forearm. And some people were saying that you can take less than 20 also to reduce the chances of instability. But usually, I would realistically keep it at 20. The poly sizes is important, so you have got a lot of poly options. That is very good part of this system. So you have a standard poly, then you have a retentive poly, then you have plus 3 poly and plus 6 poly, and then you have a 9 plus 9 mm extra base plus 9 wala hai. The case that I showed you. So you have a spacer. So this is a 9 mm spacer that you can put, and over that you can put poly. So a lot of options are there in both 0 and plus 10. Asymmetrical.
You titrated it as per the conjoint tendon tension and this thing. So like
Yes. You have to. So for once you reduce it, you have to see the rotations. You have to see the impingement-free range of motion. You have to see conjoint tension, and you have to see the shrug test. It should not be. You should not be able to dislocate the Glenosphere and the constrict. So these are the things you need to take.
I mean, like it's a fracture when there is a 4-part fracture? How do you determine how do you calculate the version? Like I want to say.
With the forearm in 20 degrees, that is perfect.
But when you enter, like,
Usually I
how do you determine that that is the right axis? Like, there is no.
There will be nothing actually, but you just have to put it and you have to take the forearm into that level with this version node. So you keep it the version node on 20 degrees and just do it 20 to 30 degrees and just do it. The good part about the fracture cases is the glenoid exposure. It will be very easy. So technically the reverse for trauma is easier than the reverse for orthotics.
And in cases like if you are fixed to this particular system, in a fracture cases, how do you fix
Fracture is difficult. They have a fracture stem, but they are launching it in India next year.
So like
It is better to use a fracture stem, standard fracture stem instead of inflection.
with the pins?
Some people have done it, but it is little difficult because they don't have fin and holes to tie their fibroscopies.
These are different poly.
So these are different polys. So you have zero, and it is recommended because this is an inlay system, so it is recommended to use a retentive poly as compared to zero standard poly. Preferably to use a retentive poly, and then retentive also you have option 0, +3 and +6, and then you can use a 9mm spacer, and again 0, +3, +6 over.
Retentive poly is it will have superior
It
extra.
will have extra. It is more deep. It is
Deep kind of
deep.
But the range of movement will be decreased.
Doesn't matter. In shoulder, usually range of motion is not a problem. With this system, the range of motion that we get is excellent.
This is asymmetrical.
This is asymmetrical point. So this will make 135 to 145.
More constraint.
So constraint, and it will be basically anti-instability.
These all are retentive. This
हाँ,
is retentive.
हाँ, ये लो.
So like if you feel that after doing your inner preparation and you're trying to fix your side of the stem, and now you feel that the need for the trial poly is there, then how do you go about it? Will you increase the poly thickness or will you increase the stem space? How do you go about it?
So it is better to put your Glenosphere initially, some little bit of lateralization on the Glenosphere. You put your stem, and then you have enough play in your poly to adjust the space. So usually it is not a problem. Even if you are
Yeah, how do you go about it? So you start increasing the poly thicknesses, and then when you run out of poly,
Which poly
you
to-
add stem spacer like in
obviously, same. But you have to put your glenoid properly, do your glenoid completely, do your stem completely, and then you can trial. You can do trials to exactly see what size is fitting in.
So after trial reduction, is there some special maneuver to dislocate?
So it is difficult. So what I usually recommend is there are two techniques. One is your finger technique, and the other technique is you can use the shoe. That is one. And the other thing, the third thing that you can take is if it is very tight, you can pass a tape around your humerus, and then you can pull it. That will be easy. So these are the three things.
teacher में hook that.
Hook. This is the tape. This is the tape you can pass underneath the humerus, and that can be used to dislocate the shoulder if it is very tight.
So this session has been.
So let's start with the session. Thank you.
Thank you so much.
Stop.